Denny was the life of the party. So if Denny was there, you heard Denny somewhere. Lori was very quiet and reserved and kind. Not that Denny wasn't kind, but just they were very opposite when it came to their personalities.
I think her sisters really wanted to be there for her, and thus why they elected to try taking care of her at home, and it just got to be too much.
So then the decision was made, that they needed more or less full-time care. The Wedum Compassion Fund was instrumental, I think, in helping Lori, who was at Wedum for roughly 4 months' time.
Gwen, my wife, said, I don't know if Denny can be at home. So we went and she called and we toured Wedum.
When Denny decided he didn't want any further care and was placed in hospice, our worry was that they would be in 2 different places and we'd have 2 young boys trying to have to go between each place to try seeing mom and dad for however many days they needed to. And then, we all wanted to make sure we were there for Lori as well. So then to have had that peace of mind knowing that he was going to be right across the hall from her was awesome. It was so relieving to everybody that they were going to be together. I think the first day that Denny went there, we had a family meal. And I think it was really good that we were all together when he got there.
Actually, it was maybe their birthdays are really close together within a day, I believe. So it was going to be a birthday party for the 2 of them. I don't know if Denny and Lori would have been there without the Wedum Compassion Fund together in the last days.
I've been a nurse at Wedum for 5 years. I started here as soon as we opened. My husband recently was in need of hospice services. After a long stay in the hospital, it became evident that he was not going to improve, and we chose comfort care. I did check with the nursing home to see if he could come back there. They wanted about $2,000 up front to be able to take him back. That's money we didn't have in savings. That would have been a house payment and a car payment that I would have had to miss to be able to pay that money to get him back there. When the Wedum Compassion Fund was brought up and we applied for that, it was such a relief to know that he qualified for that. With all the other decisions that you have to make for end of life, to be able to have that decision taken care of, and was such a relief for me. You just can't imagine how good that felt. Wedum was the first choice for me to bring him here, have him in a place where I felt very confident and comfortable with the setting and the staff, knowing that he would get the best care possible. The tradition that we have here of being able to pick out a dragonfly sun catcher to hang outside the door when someone is close to dying was very special to me. And I was able to pick out a blue dragonfly for him and put it outside his door the morning before he passed away. Then I was able to take that dragonfly home, and it hangs on my kitchen window now.
One of the things I'm really proud of about the Compassion Fund is that it allows people who otherwise would not have access to residential hospice care to have it. The shelter contacted us and said, you know, he needs to have access to medications. That's just something that we can't provide. What can we do? The social worker and the nurse from our team stepped in and said, well, we need to make a plan for him to be safe, and here's a few choices we could do, and one of those choices was for him to go to Wedum. I was there when he arrived with the social worker and the nurse, and I remember he seemed kind of stunned, actually, to be in a place where things were really, really set up for one person in one room and having a little bit of a staff of people to take care of just him. And it really was transformative in the way that the end of his life went, I think.
There's a bigger picture that I see here with the Wedum Compassion Fund, and that is that it is a great gift to the larger community. And I think someone once said, how we treat the most vulnerable in our society is a measure of that society. And I think this points us in that civic duty to provide care to all people at the end of life.